Childhood trauma significantly impacts adult addiction. Adverse experiences, such as abuse or neglect, alter brain development, increasing vulnerability to substance use disorders. Addressing these invisible scars through early intervention and trauma-informed care is crucial in breaking the cycle of addiction and fostering recovery. The scale of addiction in America is staggering, with 21.2 million cases of substance-related disorders reported in 2018. Over 70,000 annual overdose deaths occurred in 2019, with 70% involving opioids. Alarmingly, 9 in 10 women in treatment reported experiencing childhood abuse or neglect, highlighting trauma's pervasive impact on addiction. The Adverse Childhood Experiences (ACE) study highlights how early trauma, such as physical, emotional, or sexual abuse and household dysfunction, like parental substance misuse or mental illness, significantly elevate the risk of substance use in adulthood. This graded relationship underscores the profound impact of childhood adversity on lifelong health and behavior. Traumatic childhood experiences reshape the brain, particularly affecting the hypothalamic pituitary adrenal axis, leading to chronic hyperarousal and anxiety. This dysregulation fosters a reliance on substances to manage overwhelming emotions. The resulting depersonalization and emotional numbness further increase susceptibility to addiction, as individuals seek relief from persistent internal distress. Childhood trauma manifests uniquely, influencing substance use patterns. Physical abuse correlates with increased psychoactive substance addiction risk. In women, severe sexual and emotional abuse leads to earlier and faster substance use escalation. Cumulative adverse childhood experiences heighten addiction risk, highlighting the need for comprehensive trauma screening. Early trauma leaves a lasting imprint, manifesting in adult behaviors and choices. This unresolved pain often resurfaces as individuals seek relief through substances, attempting to manage distressing memories and emotions. The cycle of pain and addiction perpetuates, highlighting the critical need for addressing root causes to break free from this destructive pattern. Unprocessed childhood trauma leads to stress and emotional instability, often resulting in substance use as a coping mechanism. This temporary relief from drugs or alcohol numbs pain and anxiety but deepens dependency, perpetuating the cycle while leaving root causes unaddressed. Addressing these underlying issues is crucial for breaking the cycle of addiction. Adverse childhood experiences, ACEs, lead to more than addiction. They elevate risks for chronic diseases, mental health disorders, and social challenges throughout life. This underscores the need to view childhood trauma as a public health crisis, impacting physical, psychological, and social well-being comprehensively. Treating addiction effectively requires a trauma-informed approach, addressing root causes rather than symptoms. Screening for trauma history must be foundational in treatment programs. Early prevention by identifying at-risk children can disrupt the trauma-to-addiction cycle. Integrated care models that tackle both trauma and substance use disorders yield superior outcomes compared to isolated treatments. Recognizing the profound link between childhood trauma and adult addiction is crucial. Addiction often stems from unprocessed trauma, not character flaws. Embracing trauma-informed whole-person care respects each individual's complex story. With appropriate support, individuals can break free from the cycle, reclaiming their lives with dignity and hope.